So someone wanted to know about phosphenes in neuro-ophthalmology. And a phosphene is where you have a light perception. You see a flash of light, but there's no visual stimulus. And so it's a form of hallucination because there's no stimulus, as opposed to an illusion where there is a stimulus. And one of the most common in ophthalmology is when you have retinal disease. And so when you have flashers and floaters, that is retinal traction. And so the thing we're worried about is a posterior vitreous detachment or the development of a retinal detachment. So we're going to be asking patients about flashing lights. Sometimes the phosphene is from a mechanical stimulation, and that is the presumptive cause of the retinal traction. So we can see the traction on the papilla, like vitreopapillary traction, or on the macula, vitreomacular traction. And so that mechanical traction stimulates the photoreceptors and produces the phosphene. However, there are cases where there is no mechanical traction, or at least none that's visible, and that can occur in neuro-ophthalmology because you can have that from optic neuritis. And so patients with inflammation of the optic nerve sometimes have a phosphene. Or if you have inflammation in the retina, that can cause phosphene, where they see a flashing light. There are also cortical-based things which we don't call phosphenes, which are usually like the jagged line of migraine, or if you have little tiny circles in occipital migraine or occipital seizure, usually seizure if it's lasting seconds at a time. The fortification scotoma can have scintillation in it, like a flashing component to it. And sometimes the phosphenes are sound-induced, so loud sound might cause it. Presumably that's traction, so pulling on the eye nerve when you move your eye in response to a sound. It's not clear to me how a sound by itself could induce retinal photoreceptor or optic nerve-related phosphene. So we need to know a little bit about phosphenes. Normally for me, phosphenes suggest retinal disease. However, there are cases where the phosphene occurs in optic neuropathies. When it's unilateral, it's usually an intraocular thing. When it's bilateral, we'd like to know if it's homonymous or diffuse. And if it's bilateral simultaneous, the things you're worried about are migraine, aura, and occipital seizure, mimicking the phosphene from traction on the retina or the optic nerve.